We're going to move on to the acute low back injury POC. Some of the information will be repeated from our presentation on the MTBI POC, but some aspects are specific to the ALBI, so I think it's important to review. As with the MTBI, the ALBI POC has been selected for the demonstration project because as athletic therapists, ALBIs fall within our scope of practice, and for most ATs represents a substantial number of our patients. This is also an area of governmental and public interest, and thus extremely relevant to our clinical practice. In order for a patient to be included as a case in the demonstration project for the ALBI, there are several criteria that must be met. The patient is diagnosed with an acute low back injury, such as mechanical low back pain, muscle strain, ligament sprain, SI dysfunction, by an AT, by a referring physician, or other healthcare practitioner. The only real inclusion criteria is that the patient comes to you for treatment, preferably within 28 days of injury, up to a maximum of 42 days post-injury at your discretion. So what we don't want to include are those chronic cases that have likely developed a layer of compensatory issues. Red flags for patients to be excluded from the demonstration project would include neurological deficit, meaning a major motor weakness or disturbance of the bowel or bladder control, infection, fracture, or tumor. So some DISC patients will meet the criteria and some will exhibit a red flag. You as a practitioner will use your discretion. If a patient exhibits red flags and is not a candidate for the demonstration project, you may still choose to follow the outlined POC, but in those cases, you would not complete and submit the discharge report, as this could skew the results of the project and weaken our outcomes. Yellow flags are psychological risk factors, such as avoidance of activity, preference for passive treatments, mood issues, or social withdrawal. The combination of several yellow flags may add up to one red flag, and that would be under the discretion of each therapist. The tools we will be using to determine outcome measures are the numeric pain rating scale, which is a simple scoring out of 10, and the Rowland-Morris Disability Questionnaire, which is a 24 present, not present questionnaire that contains sentences that people have used to describe themselves when they have back pain. As with the MTBI, both these outcome measures are to be administered upon assessment and discharge of patients, and they will both be available on the OATA website. Now we will go over the recommended treatments or interventions that are included in the ALBI POC. Again, these are very familiar treatment techniques for AT. They include patient reassurance, education on things such as recommended gradual strengthening, exercises, and stretching, promotion to continue daily activities, application of heat and ice, spinal manipulations as appropriate, recognizing that grade 5 manipulations are a controlled act and can only be performed with appropriate delegation. There are several interventions that are not supported by evidence and thus not be included in the recommended interventions, such as acupuncture, electrical stimulation, mechanical traction, ultrasound, and TENS. As stated last week and again earlier this evening, if a manual technique or use of particular modality is in your scope of practice and you feel competent to administer it, and you feel as though the administration of that technique or modality will be in the best interest of your patient, then you may include it in your treatment. Whenever possible, however, please try to stick to the recommended interventions listed above on the previous slide. The particular POC is divided into two phases, being weeks 1 through 4 post-injury and weeks 5 through 8 post-injury. According to the clinical evidence, the majority of patients should return to their pre-injury function during the first phase, and the second phase should be necessary only in exceptional circumstances. Please refer to the OATA website under the POC link for the algorithms and discharge reports for the ALBI. One more time, For the project, all right then, almost there. One more time, for the project to have any measure of success and usefulness, a discharge report for each patient included in the demonstration project must be completed fully and appropriately and submitted. This can be done using the fillable forms on the website and can be submitted electronically. And we're ready to take your questions at this time. Please type any questions you have into the WebEx section located on the right hand of your screen.
Any questions at all? Anybody? Oh, here we go. So Mariana asks, will you contact us when we can start using the PSC process? Absolutely. Mariana, as long as you're on Sarah's email list, and I believe that you are. Yeah, so I think she said she's spoken to you. It's Steph Moser, by the way, in case anybody wasn't sure. So absolutely, we'll have a start date. We're looking at the end of the month or the first week of June. To begin collecting cases for anybody that's appropriate. So we will let you know exactly what that start date is. And the project will last approximately a year, so we can collect our adequate numbers. Steve's also asking, with the back treatment, it said no electrical stim and treatment protocol. Does that include IST treatment? It does. So any electrical modality is the reason that it's under the not recommended is because it hasn't been proven through research. So it's just not a proven technique. So if, again, if there are techniques that you feel are in the best interest of your patients, we're not going to tell you not to do them, but we would like everybody to follow the protocols as closely as possible. The results have, they really stand, they speak for themselves. When the programs of care have been followed for the last 6 to 7 years, the LB being one of the sort of, it was one of the first ones to be rolled out, actually. So there just isn't the worldwide evidence to support the electrical modality use. Doesn't mean it doesn't work. It's just it hasn't been proven to work. So the protocols were based on the most up-to-date evidence available. Any other questions, you guys?
Okay.
Somebody's typing, maybe?
No, Mariana has a second one.
Oh, okay.
Any of the discharge reports are on.
Oh, are these forms on the website already for us to print off?
Discharge is just electronic.
Yeah, so if the ones that aren't up yet will be up this week for sure, so you can read. There's a more expanded version of the programs of care, the ones that Sarah alluded to earlier, that really show inclusion, exclusion, red flags, treatment interventions, not recommended treatment interventions. It's more lengthy, and it will really give you the opportunity to get a handle on how to use the programs of care most effectively. The ones that aren't up yet will be up within a day or two. The discharge report that will also be available can be printed off and filled out. However, we've had them created and branded for us to be fillable. So it's easiest for us if you click the links, fill them in, and click the link to submit, and then it's electronically stored so that when it's time for us to have that data analyzed by an independent source, it doesn't have to be manually inputted at our end, which saves us a lot of work. So if that's something that you're able to do, we would most appreciate it. Hope that answers Mariana's question.